watikana ne chinkwana cy'umugabana Gov Nyaribo gochaso mu waziri bobachano Duale igo litukolera rero homo senator we county ya Nyamira omusika kongo Omogeni aisokire na komochi homo ske Nyaribo ubona chingike cyo ni go bigo omusika kongo aruro kobolia gochi asomo gavana kwene kibuna kubikale mirobiri yogochi akobakonya abantu na tali chinkwana cy'okurama.
Mr. Speaker, yesterday, CS Duale, CSL, was before the Senate, and he made some comments, I think out of the sympathy he has for the people of Nyamira. And he said he wanted to be very frank to the people of Nyamira, and he said healthcare in Nyamira has collapsed. And I thought the response from my good friend, Governor of Nyamira, would have been to reach out, just pick a phone call, get an appointment, come to Nairobi, go to the office of CS Duale, a very dedicated public servant who wants to improve our health care. But I saw this morning, I think at 11, the governor of Nyamira called a press conference. Duale has nothing personal against the residents of Nyamira. I think its only concern is that they have done an evaluation, which I believe is professional, and found that healthcare in Nyamira has collapsed. Okay? And I expected the governor to reach out. But instead, Mr. Speaker, I heard him hurling abuses at the CS and saying, CS, you have personal interests. I'm going to expose how corrupt you are, which I thought was very unnecessary. I want to advise my governor, through you, Mr. Speaker, that when some of these issues are raised on the floor of the House, it's because we want service delivery to reach our people, Mr. Speaker. As we speak, CS Duale discovered a lot of fraud in one of the level 4 hospitals called Nyamusi. And that hospital, as we speak, has been deregistered from provision of SHA. And citizens of Nyamira who go to Nyamusi, and that's where the honorable governor comes from, don't get services, Mr. Speaker. Instead of abusing the minister, the CS, the cabinet secretary, what I would have done, Speaker, if I was the governor of Nyamira, would have to reach out to the CS, Duale, engage him, ask him to restore the provision of SHA to Nyamusi Hospital so that our women who are giving birth can get these services using the SHA card. But telling the CS that you have never visited Nyamira, you are corrupt, we know the personal interest you have, it doesn't help our people at all. And he says there are a number of payments that have not been made to the county government of Nyamira by SHA. The CEO SHA is a good lady, Dr. Masi Mwangangi. I'm requesting and making an appeal to my governor to also make use of his senator. My office in Nairobi is open. Anytime he wants an intervention, any assistance to, if there is money that has not been sent, let him talk to me. I've sent money to Nyamira now. My budget is over 6.2 billion. When you put together with conditional grants, on source, we are dealing with 8 billion. But I was shocked today that the governor is confessing that Nyamira has no MRI. I don't know whether in Garissa you have an MRI machine. I don't know about Migori, Mr. Speaker. But to call for a press conference and confess before the residents of Nyamira that there is no MRI machine for cancer screening in Nyamira was shocking to me. To confirm to the residents of Nyamira that the last time we received a consignment of medicine to our hospitals was in May, and that since May, the next consignment was being delivered today. It's a big disappointment.